afternoon, everybody. My name is Shay Mandel. I'm the President and CEO of the Medical Alley Association, and you're joining us today for a webinar, Stop the Spread, How to Protect Employee Health During COVID-19. And we are honored today to have with us Jay Miller, President and CEO of Nortech Systems, and Linda Homan, who's the Senior Manager of Clinical Affairs with Ecolab. We appreciate all of the attendees out there for joining us today. We've scheduled 30 minutes and we have a lot of great information, so we're going to get right to it. You'll also notice you can send questions in, and we are going to reserve a small amount of time at the end of the presentations and conversation to take some of your questions. So with that, I'm going to hand it over to Linda Homan, Senior Manager of Clinical Affairs at Ecolab, who's going to walk through her slide presentation. Linda?
Hi, everybody. Great. Thanks for letting me come on and talk to you today. And I'll wait for the slides to pop up here, and then we'll get started. There we go. Okay. So we're going to talk a little bit today about best practices for working safely. And I'll just tell you that this is the presentation I'm giving you, or what I'm going to talk about, is kind of our experience at Ecolab, and obviously everybody has a different approach to this, but maybe this will at least just give you some ideas about some approaches that other companies have taken, and maybe you can get some information that'll be useful to you. So next slide, please. So I started out with just general guidelines. Let me just minimize the screen here so that I can see what I'm trying to say. So these are obviously things that you're already aware of, but always follow the local public health guidance. We follow guidance that's based on CDC and the World Health Organization best practices. We follow them very closely. We have a group of people here that at Ecolab who track that really closely and have good connections there and keep track of everything so that we can be up to the minute. Always have to obviously follow your local labor and employment laws if they're applicable, and thinking about always abiding by your customers' expectations or requirements if they're more stringent. And so we've developed some guidelines, but if the customer's guidelines are more stringent, especially particularly if you're calling on a hospital, then you'd want to follow those. And then we always encourage employees to call ahead to a healthcare provider before going to healthcare, just because, as we know, they don't really want a lot of people going there for assessment. They would rather have them call in and make an appointment. And then obviously, if employees had symptoms related to COVID-19, we wouldn't want them to come to work. And our basic approach is just that the #1 priority is to keep the associates safe, and that by taking care of the people that work with us, then we also protect our ability to serve our customers. So that's kind of what's underneath our approach to everything that we're doing. Next slide. So I have it broken down into basically 3 different categories: preventing transmission in the plant, protecting associates in the RD&E office or the office setting, and protecting them in the customer sites. And so I'm just going to go through these and sort of give you our work that we've done and what we're working on to try to keep people safe out there. So we obviously always want to make sure that we can provide the necessary personal protective equipment and supplies, and that varies according to the situation they're going into. And so I have an example of how we handle that with the field in a couple of slides. We always enhance stringent cleaning and sanitizing protocols. We're a cleaning and sanitizing company, so this is something that we already do, but we just make sure that we reinforce it and train people and spend a lot of time thinking about that as we're developing our protocols. We always implement social distancing in the manufacturing plants, so implementing changes for the use of break rooms and locker rooms, making sure that they're set up in a way that there can be social distancing, making sure that we don't have too many people in there at any given time. We adopted some new shift change protocols so that we were not having our shifts overlap as we would have had in the past. And that's another way to just ensure social distancing. We canceled all physical gatherings and meetings, and while that's hard, especially during a stressful time, we're trying to use alternative methods as much as we can to keep people informed and engaged virtually. And then obviously we restricted visitors to our manufacturers' plants, and we restricted employee travel unless it was critical. And then the next slide, please. So preventing transmission in the office or the RD&E facility, starting, I would say at least 2 weeks ago, I'm trying to remember, and it's kind of become a blur now, but I think about 2 weeks ago, we started working from home, those of us who could, and that's a vast majority of the people who work in our corporate office here in St. Paul and also in Atlanta and around the world. And then we restricted travel, so we have no international travel. We do allow local travel if it's business critical. And then for those that must work on site, we obviously tell them to stay at home when they're sick or they're immunocompromised. We've canceled all the physical gatherings and meetings and try to use alternative measures. So we use WebEx or Zoom type meetings. We have lots of obviously email. We have Skype. We have different ways to stay connected. Texting, cell phones. You know, it's a virtual world these days anyway. We coordinate schedules to minimize contact, and that's true especially in the RD&E office. Now that we've closed our offices for people who can work from home to stay home, we still have folks that have to go into the RD&E offices to work, and so we've put some processes in place to restrict contact with each other during that time. Obviously restricted visitors to all of our businesses and offices. We've tried to communicate as much as we can, and that's so critical at this time, to just keep a steady flow of information and connection with your associates. And so information on how to protect yourself and others. We've created fact sheets and definitions of terms that might be new to some associates, FAQ documents, guidelines, and protocols. I feel like we've just been constantly generating content to share with associates and to direct our business for the last month. And it's a full-time job for all of us, but it's an important job because it keeps everybody on the same page. Obviously, social distancing and hand hygiene, which you can't talk enough about, it's all of a sudden become a very popular topic. And as a person who's a former infection preventionist or still an infection preventionist, I think it's amazing how hand hygiene has become top of mind for so many people now. That's maybe one positive outcome from all of this, is that people will think more about hand hygiene. Next slide. So this is preventing transmission in the field, and I think it's important to develop very clear field continuity plan. And I just got off a call right before this with our VP of sales for our healthcare division about, we updated our field continuity plan last week, and we found a place where we need to be more clear and go back and more clearly define some pieces of it. And so we're just constantly tweaking it and trying to make sure that it's as clear as possible. Part of what we're trying to do is determine the need to enter the site. So if the service can be performed remotely, then absolutely do it remotely. If the service can be delayed without impacting the business of your customer or creating a safety issue or a health and safety issue, then reschedule the service for a later date. And then if they feel they need to go in, then we created a decision-making guide. And I showed sort of the top level of it on the screen here. So we kind of broke it down by the field associates' potential contact with people who have COVID-19. And then from there, we've given them really clear criteria for what they can do in that customer site under those different circumstances, and some really clear guidance on that. And then we clearly define those, what is a critical on-site service? What are the reasons why we would think they might need to go into a hospital in this case and service a customer? And then we outlined our general rules, which you'll see over on the right. And these are a lot of the same things that we just talked about for the other settings that we have. Some exceptions to this might be the exercise the stop work authority. So the ability to make the decision themselves if they feel unsafe in a situation. For instance, if there wasn't PPE available for whatever reason and they were asked to go into a setting where they felt like they were at risk, they would obviously have the ability to just stop work and stop and rethink that and figure out an alternative. And so we included those general rules into our conversations. And then I think the last piece that was really important for our field is a really clear step-by-step processes for what to do to prepare to go on site, what to do once you get on site, and then what you do after you leave the site in order to ensure that you can service the customer but stay safe at the same time. That includes things like after leaving the site, disinfecting your tools before you leave the site, things like that. So trying to be very, very prescriptive about what they should do. Next slide, please. I think that actually might be the last slide. Oh, this is so this is sort of the what to do if an employee tests positive for COVID-19. And this was a very hard thing to come up with, but we ended up developing an action plan for every scenario. And as you can see, the scenarios listed there at a high level. And then for each of those scenarios, we would describe what the employee action should be and what the company's action should be in order to maintain the safety of the associate as well as the safety of the people that might have been exposed around them. And all of that was part of our supply chain HR playbook. And it includes things like contact tracing, going back 48 hours before an exposure, developing protocols for notifying coworkers and visitors to our facilities who may have come in contact with an infected employee, a process for employing or notifying customers if a field employee tests positive, the instructions for use for disinfecting the work area where the employee might have been in contact with surfaces, and then just instructions on self-quarantine of employees who are in direct contact. And that includes, again, really prescriptive instructions on how to self-quarantine and even some guidelines for the household members of people who are self-quarantining. And then obviously we have access to a corporate medical advisor if there are situations that we need an outside opinion or a medical opinion outside of our own organization, then we can contact that corporate medical advisor. And I think that might be my last slide. Yeah. So with that, I'll stop and see if Jay, I talked right through that and I didn't even give you a minute to jump in and say anything that you might want to say. So anything else that you want to cover off on that I said there?
No, Linda, look, I thought that was great. Thank you very much for doing that. It's a great overview. And I didn't want to interrupt you because you were on a roll, and that's all very important information for everyone. Let me just touch on a few things and really pass along our experience through this whole thing. And everyone knows who Ecolab is. Not many people who know who Nortech Systems is. We're a engineering services and contract manufacturing company, mostly in medical, but we also do work for the defense industry and general industrial. So we've got about 100 customers that are reasonably large customers in each of those three market segments. So our experience is a little bit different. Clearly, medical is a big part of it. We've got 8 plants worldwide. 6 plants here in Minnesota, a plant down in Monterrey, Mexico, and a plant in China. And part of what I wanted to bring up was our experience in China. We started hearing about COVID-19 coronavirus in China, of course, late December, early January. And we started becoming concerned at Nortech about impact on our business and impact on our supply chain immediately. And of course, everyone was either off on holiday, Chinese holiday, or trying to get back. And as we all know now, the Chinese government extended the holiday for a period of time. So we were a little concerned about getting people back in Suzhou. Suzhou is located about 800 kilometers from Wuhan. So we were a little concerned about that. Fortunately, we were lucky enough that nearly all of our employees were able to get back to Suzhou. We ramped up pretty quickly, but we immediately started to respond to this because we were just concerned mostly for our employees. So we started communicating with our employees and our customers and our suppliers and our board of directors pretty frequently and pretty quickly. Obviously, we had customers that were concerned about supply chains. We have a lot of supply chain work that goes through China, independent of our Chinese plant. So we were in frequent conversation with a lot of our customers, and again, our suppliers and our board of directors, and of course our employees, because our employees were concerned. We implemented social distancing and reiterated personal hygiene care and including workstation care, as Linda talked about, common areas, making sure the common areas were cleaned before and after, limiting the number of people that were in the common areas at a particular time, trying to keep people far enough apart, if you will, and making sure that we told everyone, if you are not feeling well, the default is stay home and keep us informed as to how you're doing. We also, I mean, because it's China, it's a little different here in the States, but in China, they're very used to wearing masks. So and they were a little bit short of masks, and believe it or not, we've got masks here, and we sent them to Suzhou so that we had enough masks there. As it turns out, they have enough masks there. They've sent a lot of those masks back, and we're keeping a small number of those, and we've distributed those to hospitals that have ICUs in and around all of our plants. We didn't want to wait on that. We decided we'd get them back proactively as quickly as we can and get them to the places that needed them in the hospitals as fast as we could. So, but the bottom line of the whole Chinese experience is we were reacting. We weren't being proactive. And if we learned anything as we were thinking about this and talking about this, 7 days a week, starting in late January and all through February and into March, was how are we going to get ahead of this, because this is going to come here, and it's going to come here faster than we all think. So we tried to get out ahead of making sure we were talking to all of our customers. Now, we'd already gotten in that habit, making sure we were tracking our suppliers, but we're also taking a hard look at our supply chains and making sure that we weren't going to be caught by a single supplier that was going to be down hard, which would leave us lying down and leave our customers. And as you might imagine, since most of our customers are medical and defense department suppliers, it's bad when they're lying down. So we wanted to make sure that we were working with our customers if there was any input they needed or we needed from them, to make sure that we were finding alternate suppliers as quickly as we possibly could, so that we didn't find ourselves in a situation where we were stuck with a supplier, say in Wuhan, and nobody was even in the plant. We did have some situations in China where we had to scramble a little bit, but we were able, for the most part, to keep our supply chain going there and to fill in supply chain where we had gaps. So here we wanted to let our employees know as quickly as possible that their health was of the utmost importance, and that the decisions we were going to make were going to be made with that in mind first. I think our employees appreciate that. Fortunately, to date, we have had no one test positive for COVID-19. Candidly, I think it's a combination of I think good preparation and good habits that we've gotten people in, and a lot of those habits we learned from our experience in China. But also, candidly, we've been a little lucky, and we know that if and when, and we have to understand that the chances are reasonably good that someone is going to test positive for COVID-19. Depending on the scenario, we have tried to think through exactly how we would react to that scenario. Now, Linda and Shay and I could go through hundreds or thousands of different scenarios, so we're not going to try to walk through all those things. But the thing I would encourage you all to do is carefully and proactively think about those scenarios now, so that when they occur, which will be, under a little more emotional circumstances, you can make rational decisions based on pre-thinking. We went as far as we had a board meetings on March 17th and 18th. We went as far as laying out in detail 3 different scenarios, high-level scenarios for our board: a more optimistic scenario, a realistic scenario, and a more pessimistic scenario. And we walked through the board exactly how we would react under the conditions of each of those scenarios, knowing full well that however this shakes out probably will not fall cleanly in any one of those categories. But we wanted to make sure that we were staying out ahead of that. We pretty proactively, Linda touched on this and it's great, we were a little more hardcore about it. We told our customers and our suppliers basically on March 12th that there was going to be no travel to them, and there was going to be no inbound travel from them. Now, which makes it a little bit interesting, because some of our customers, especially in the defense department side, like to see the product before it's shipped to them. But even under those circumstances where we had legal obligations to do that, we have figured out ways of doing that virtually that they have very quickly agreed to. So these are different times, and under different times, people will agree to different processes that are better overall for the health of the employees of our customers and our suppliers and our employees. We've moved very quickly to, as Linda mentioned, we moved very quickly to work at home for everyone that can. Now we have hundreds and hundreds of employees in Minnesota and China and Monterrey, Mexico that cannot work from home. They are online, so we've changed those lines in a lot of ways. We've implemented social distancing so people are far enough apart. And in the cases where they have to be close, people are already wearing masks. People are cleaning their workstations before and after every shift. We, as I mentioned earlier, we're cleaning common areas at least twice a day. We're deep cleaning every night. And we're doing that 7 days a week because we got people working overtime. We've had a lot of people working over the weekends as well. So with that, I don't want to talk too much here. With that, I want to hand this back off to Shay, and I hope some of that is helpful.
Well, thank you both. We are getting some questions in, and I think we can package up a couple of them. I think you guys have outlined how to be prepared and how to react. One of the questions relates to having to shut down a facility. So one of our questions is, do any of your protocols require a facility shutdown in the case of a positive COVID-19 case? And Jay, one specifically for you, which, you know, is alignment. Did your facility have to close down for any period of time? If so, how long and how did you manage that? So I'll kick it back to both of you. Let's talk a little bit about, when do you actually have to shut down a facility?
Yeah. We have specific situations under which we will close down a plant, or we will certainly close down a line depending on the circumstances. We are not, we've got a lot of critical product we've got to get out, but we are not going to be afraid of shutting down a plant for hopefully not a long period of time. But if we need to shut down a plant and send everybody home and make sure we're tracking to see how everyone's health is because we've had somebody test positive, we will do that. Now we'll want to get the plant back online as quickly as possible, but we're going to default to taking care of the employees first and foremost, and we'll tell our customers and our suppliers that right away. But fortunately, we haven't had that situation yet. We've also thought about situations where we may just shut down a line or a segment of the plant so that we can separate that part of the plant out and deep clean that particular plant, and then send the people on that particular line home so that we can track how their health is, as opposed to shutting the whole plant down. So it really depends on the circumstances. But we've thought about all of these things, and we may be in a situation where we do have to shut down a plant or a line for a period of time, a week or two.
Yeah, I'll just echo what Jay said. I think there are scenarios where we would shut down a plant or a portion of a plant, and we would do that, as he said, always to keep the associates safe first and foremost, because, obviously, like we've both said, if you don't have your associates safe and up and working, then you're not going to satisfy your customers either. So out of abundance of caution, we would shut down a plant or a line if we had to.
Well, part of the reason that we invited both of you to participate in this webinar is that obviously we have a lot of members of the Medical Alley Association reaching out and starting to ask questions, smaller organizations than both of yours, looking to get a lot of great information, which you've provided. But so for those folks who are still putting a plan together, taking a lot away from what you guys are outlining today, but also fearful that, the wave is coming to Minnesota, you provided a ton of information. And what are a couple of the things that, if you're the decision maker in an organization that didn't have redundant plans in place and haven't gone through what you guys have gone through, what are the one or two top things that you would say, keep your eye on this prize, focus on these things? What are kind of the keys for the smaller members out there?
Well, I could go first, and I'll just say that I'm going to have my clinical hat on, so I'll be thinking about the disease and the process itself. And I'm sure Jay can answer it more from an operational perspective, and that might be a good way to look at it two different ways. But for me, the things that are first and foremost is having a way to screen or have people feel comfortable self-identifying if they have symptoms, so that you can then contain that and manage it as quickly as possible and with as little transmission as possible. And giving people the information they need and the comfort that if they do report, that they will be taken care of, and that perhaps their financial livelihood isn't going to be impacted by that. Because if you don't do that, then they're going to tend to not want to tell you if they might be infected, if they feel like it's going to impact their livelihood. So that's one thing that I would say is just the ability to make people comfortable with reporting. It would be really key.
Yeah. But by the way, that is the most important thing. She's 100% right, is making people comfortable to report. There are going to be situations where someone comes in and says, my spouse is working in another plant and they found out that someone that visited that plant has tested positive. How do we handle this? And you want to be ready with that. And that we actually had that case, and we asked the employee. Fortunately, that employee can work at home, so we asked that person to just work at home and followed their health and their spouse's health. And as it turned out, neither one of them had picked anything up. But defaulting, I would say, to highlight that, always defaulting to the thing that's in the best interest of the health of your people is in the end the right thing to do. Right? It's the best thing for the employees, and it's the best thing for the business. I believe. The other thing is, and I know we're kind of in reactive mode, but if you walk away from this, other than that previous point, which is the most important one, if you can be as proactive as possible now, knowing that this is here among us, and planning, and as I mentioned, planning when things are rational and not emotional, to me, that's probably the most important other thing you can do.
One of our next questions, you both talked about screening employees as they enter. What are some suggestions that you have on the best way for companies to employ screening at their facilities?
Boy, that's a big question.
It is. I'm going to let you answer first.
The 30-second answer.
I'm going to let Linda answer that one first.
Right.
I think you have to be really aware of the laws and the employee rights in the area that you're looking at. And in fact, I looked into this anticipating this question ahead of time. And I found that the Equal Employment Opportunity Commission has just recently published a guidance about pandemic preparedness in the workforce and the Americans with Disabilities Act. And so it gives guidance. It was just published maybe a week ago or maybe 2 weeks ago. It gives guidance, I think, on what the employees' rights are and what you can and can't do in terms of screening employees. And so I would recommend that you check that. And obviously that's US based, but I'm sure that other countries may have similar, or that would be a good starting point. Jay?
Yeah, look, I think that to your point earlier, which is the most important point, the point where people can self-identify how they're feeling, they're volunteering that information. It makes it a lot easier. I will say, checking people's health through, thermometers and that sort of thing, really easy to do in China. Not so easy to do in the States, may or may not be easy to do in Mexico. We do have to protect people's privacy in terms of their health. We know this very, very well. That's what HIPAA is all about. So be very thoughtful about that, and then really just track to see what's going on. These are extreme circumstances. So some of what we would typically consider to be HIPAA gray areas may not be as gray. We might be able to get some help there in the best interest of the employees. But again, going back to employees being really comfortable about self-identifying how they feel, look, people are going to know, for the most part, people are pretty aware about how they're feeling, and they're going to know most likely before we screen any of them if they're not feeling well.
Yeah, I would just add to that that having a fever is sort of a lagging indicator of whether you have this infection or not. And so that's not to say that you shouldn't do it, but I just think you have to be aware that the absence of a fever does not necessarily mean the same as absence of COVID-19. So it's certainly one thing you can do, but it's not going to answer all the questions you might have. And so again, people's willingness to self-report is probably going to be the most important thing.
Fantastic. Well, we are actually about out of time. For those of you that have submitted questions, and I know there's a couple out there that we didn't get to, Medical Alley staff will take a look at those questions and work with our experts to try and get you some answers. We are recording this, so you will be able to rewatch this webinar from our website, and slides and everything will be included, and we'll be able to distribute those if people are interested as well. So Linda and Jay, I want to give you both an opportunity just to say goodbye and sign off, but on behalf of the entire community, let me please first just say thank you. I mean, everybody's out there running fast and furious, attempting to deal with this truly unique set of circumstances. And so for both of you to take the time, especially given what you're dealing with, the great companies you represent, the importance of the work your companies continue to do as part of this, really a gift for both of you to take the time to spend with us. So again, Linda, please, final comments, and then Jay.
Okay, well, I just want to thank everybody for the opportunity to talk to you today. And I, like you, have learned so much about this issue and about employee health and ways to manage these crises in the last month. It's a journey that we're all on together. And if there's anything that I can do to help, I'd be happy to try. But again, thanks again for the opportunity.
Thank you.
Yeah, thank you again. I would leave everyone with, just track how what the CDC is posting, what the Minnesota Department of Health is posting. Stay on top of those things. Linda, I want to thank you. I learned from you. I knew I would. Thank you very much. Hey, you guys in Medical Alley are performing a great service for the community, and we all really appreciate that. I hope I can speak for a lot of people in that sense. What you're doing with these webinars and keeping people informed is very helpful. So thank you very much.
Thank you, Jay. And once again, for all of you attending, no surprise, this is going to be increasingly a mode of communication for the association. So we've already got several webinars lined up over the next couple of weeks, specifically targeted at these issues that you're all dealing with during the COVID-19 pandemic. So I'll encourage everyone, continue every day to visit us at medicalalley.org. You'll find a lot of information on what our member companies, including Nortech and Ecolab, are doing to bring the fight to COVID-19. A lot of information on our Resource Connect tool, which is connecting those with needs and those with resources and capabilities. We've had over 3,600 people visit that site and have been able to collect 300 forms and make a lot of connections. So again, I encourage you every day, go to the website, but stay tuned for more great content. Everybody stay safe, stay healthy, and we'll get through this together. Thanks for your time this afternoon.